Afternoon, everyone. My name is Shannon McBee. For those of you who do not know me, I'm the state epidemiologist for the West Virginia Bureau for Public Health. And this is the Kanawha County HIV Taskforce meeting.
This is Debbie Hissam.
Hey, Debbie. We're going to go ahead and get started today. I believe Andrea Lanham, our communications director, has dropped an agenda in the chat button for you guys. Just a note, we are recording this meeting and we'll be posting that to our website. I'm going to pass it over to Andrea just for a couple of opening remarks in terms of how to ask questions. And we appreciate you guys giving us a little grace as we move to this new virtual format in order to keep everybody safe and healthy. Andrea?
Hello, everybody. Like Shannon mentioned, this meeting is going to be recorded and will be posted to DHHR's YouTube channel. We do ask that media hold all questions till the end of the meeting. And just to keep things in order, if you can just put your questions in the chat just so we can get to you, that would be helpful for us. That's all I have.
Thanks so much. I believe we've got Dr. Amajad on the phone. I don't know if you're able to hear us or if you want to say any opening remarks before we get started.
Sure. Just want to welcome everyone to this afternoon, and if anyone has anything after this meeting, they can email us. Do want to thank Shannon and her team for putting the slides together. Also want to thank Amy and her team and everyone else who's been working on this. And I think Dr. Sherry Young is on. I want to thank her for her service during this time as well. And appreciate everyone's time this afternoon. Thank you.
Thank you so much. And actually, I'm going to give the mic over to Dr. Young if you want to say any few remarks. I know you're still acting as interim director at the Kanawha Health Department. And again, as Dr. Amajad said, thank you for your service.
All right, thank you. And I want to thank the state. Thank you, Shannon, for putting this together. And thank you, Dr. Amjad, for helping facilitate this meeting. This is something that it has been very difficult trying to balance, as you guys know, between COVID response and trying to do the HIV outbreak, the justice that deserves it. Thank you to everyone who's attending. And we at the Kanawha Health Department, we are happy to follow up with any issues as far as testing and outreach and those things moving forward. So thank you to everyone today, and I'll hand it back over to Shannon.
Thanks so much. Yeah, just to echo, we really appreciate everyone's grace during this unprecedented time that the state is facing as we are all trying to juggle multiple priorities. This is definitely a priority of the state and the Kanawha Health Department, as well as many community partners here on the call. So I do appreciate your time this afternoon. And with that, we'll go ahead into a brief EPI update that I'm going to provide, and then we're going to switch it over to some partner updates and then open it up for some discussion and steps moving forward. We're really interested to hear from the larger group on how we want to proceed with this meeting moving forward, how best to serve you guys. All right. And before we start, if we could please mute our lines so that everyone can hear the presentation. All right, well, this is a slide that most of you are very accustomed to. We're going to start off with the new HIV diagnoses in Kanawha County as seen on this epidemic curve. So we know that based on a 5-year average, the expected number of new HIV cases in Kanawha County per year is approximately 14 cases, with less than 5 of those cases being associated with injection drug use. State surveillance data did indicate an increase from 15 cases in 2019 to 40 cases in 2020, with 29 cases reporting injection drug use in 2021 alone. This data does represent residents of Kanawha County, or individuals who were homeless in Kanawha County at the time of HIV diagnosis. The current data reflects an increase of 11 new HIV diagnoses since the last time that we met in July. 3 of those were inpatient. 3 were detected by the CMC Ryan White Clinic or through outreach testing. 2 were detected through the West Virginia Health Right, and 3 through partner services. Next, looking a little closer at the breakdown of cases associated with this outbreak. So we've identified a total of 84 newly diagnosed cases of HIV associated with injection drug use in Kanawha County since the beginning of 2019. Roughly 52% are male. Over 80% of the cases are between the ages of 20 and 40 years of age. Nearly 50% reported either being homeless or being unstably housed in the past 12 months, which is consistent with what we've been seeing throughout this outbreak. Approximately 88% are co-infected with hepatitis C, which is also something we would expect given the injection drug practices. And then nearly half being diagnosed in a hospital setting at 46% and over 20% being diagnosed by the Ryan White Clinic or through outreach testing. Whoops. Next, looking at medical status of the Kanawha County outbreak cases, specifically the care status, has increased across all categories. Of note, there is an increase of 10 individuals ever linked to care since last month, and an increase of 3 people currently engaged in care, and 1 additional individual who was virally suppressed at the last test. I will make note that case numbers can have unusual fluctuations for a variety of reasons. Still engaged in care is documentation at the care event within 90 days. And most often that is a laboratory result. So we could have received an old lab greater than 90 days old from another state during routine reconciliation, which would put someone in the ever in care category, but not current. And unfortunately, we are still having some issues with electronic laboratory reporting. So some of our lab data is approximately, has a 4-week lag time, which is likely artificially lowering the numbers somewhat. And then lastly, I did want to make sure we bring folks attention to the new HIV outbreak website that we have put up. Shown on your screen right here. It does have specific data related to the outbreak, as well as the EpiAid findings and recommendations from CDC and other HIV testing and care resources. And that is my update for this afternoon in terms of the epidemiology of the HIV outbreak. I'm gonna try to stop sharing. And then I'd like to turn it over for just a couple of opening remarks to our Deputy Commissioner, Amy Atkins, before we go into our partner updates. Amy?
Yes, sure. Good afternoon, everyone, and thank you for joining us this afternoon. Appreciate the update, Shannon, as well. We continue to work in collaboration with the Kanawha Charleston Health Department and community partners in the area to support the response effort. And we really appreciate you joining us today. We do want to use the rest of the time this afternoon to provide updates from community partners regarding the current and ongoing response activities. Additionally, we're working with the Kanawha Charleston Health Department to take a stronger role in coordinating some of the response activities, including providing support to the task force meetings. And we recognize that it continues to be a very challenging time for our state, for partners in Kanawha County and across the state, as we continue to address the pandemic response needs. And that continued and sustained effort to respond to the pandemic, we recognize places significant strain on resources at all levels, making your contribution to this response more important and also very challenging at times. Our priority continues to be to support community partners and work alongside you and with you to design and implement activities that address the needs of this response. while also supporting and promoting transparency and reporting progress on these activities. And as Shannon mentioned, we welcome feedback on the best way to approach that. We did launch this website as a means of providing routine updates that can be accessible by the media and the public, but we welcome additional feedback on how to continue to do that. Again, we really appreciate your involvement, the work that you're doing at the community level to implement response activities that need to be innovative, that need to be creative to address this complex issue. At this time, I'd like to turn it over and redirect the agenda to our community partner updates. Shannon, I think, is Christine Teague. Are you first on the agenda for those?
Am I first on the agenda?
We caught you while you were eating
We
lunch, I
did.
think.
Oh, that's fine. That's fine. And so I'm assuming you all can hear me.
We
We can
can.
hear you.
Okay. Well, I am not Douglas Slane. I'll just start by saying that. I've been doing some lectures for WVU this week, and Doug Slane is one of the faculty members. And so the Zoom link somehow got screwed up. But I'm Christine Teague, and I'm working with the Ryan White program here at CMC. And Shannon asked me the other day if I would be willing to talk about what we've been doing here to address the outbreak. And of course, I'll be glad to do that. And I have a couple different areas that I'll focus on. One is just Shannon presented the sort of the overall snapshot of the care continuum components for the total outbreak. I can tell you, as far as the people that we are actively engaged with taking care of or currently looking for, there's 68 people on our list out of the 80 some since the outbreak began, or we started counting in 2019. It's a little bit less because some people unfortunately have passed away or moved out of the area. But of those 68 people, 44 of them, or 65% of them, we have actually had contact with, either a clinic appointment, a lab draw, which I think is fairly good. And of that group, the 44 people that we've had contact with, 16 or 40% of them are currently undetectable. So that's the good news. However, 24 out of the 68, we've not had any contact with whatsoever. So we've been unsuccessful in getting them to an appointment or to get a lab draw. So that's 35%. So overall, of the 68 people that we're looking at, 25% of them are in care, on meds, and suppressed. But I will say that looking back, the large majority of people that were diagnosed in, say, 2019, early 2020, we're slowly getting them in. It's really the newer group, people that were diagnosed this summer or late in the spring of this year, we're still working on. And our staff their efforts have been tireless. Our Brooke Parker and Ron Gibbs and Denise and our nurse practitioners have just been really rocking it, working with our community partners to try to find people and get them linked and engaged in care. And some of the things that we're doing from a service delivery standpoint to make changes or adjustments is we know that, for this group, it's difficult for a variety of reasons to come to the clinic appointment here at Memorial and the Kanawha City campus. Some things that we've done is we've pretty much opened appointments in the afternoon so that we pretty much we take people, walk-ins. We try to make it as convenient as possible. And we do have extended hours to evening hours one day per week. We obviously are able to provide immediate transportation from wherever that person might be. If Brooke is out and has found somebody on the west side, or Trista or Colleen from Health Right call me, they've seen somebody over on the west side, we're ready and able to link them immediately to care. So that's worked quite well. And when they're here, we do some contingency management to try to entice people to come in to do things such as help with obviously linking to housing resources and addiction treatment, emergency utility assistance or food assistance. We have gift cards for fast food. We have meal tickets for our cafeteria, and we have the food pantry here, which people will take advantage of. We are working to, even that with all of that, with the extended hours, with trying to get people in and out more quickly, we know that there's still a lot of reluctance on the part of many of the folks to actually come to a clinic appointment here at CMC, which can be intimidating. Maybe they've not had good experiences in the emergency department. So we are in the process of trying to, or putting together a mobile team to go out Tuesday, Wednesday, and Thursday afternoons to actually go to the people. I've been wanting to do this for a long time, but where we would actually go and meet up with people where they are and do the lab draws there, give them their meds there, give them injections for their syphilis injection or their vaccines that they need. And so we are looking at, we've gotten the approval to use, it's a church over on the west side by Schoenbaum. It's kind of in the northern Charleston. It's close to sort of the loop, the horseshoe loop over there. 2 afternoons a week, as well as back behind the hotels in Kanawha City one afternoon a week. So we're hoping that being able to go closer to where people are and get them in and out quickly with fewer people involved and not in sort of an as intimidating environment, that we'll be able to perhaps reach some of those that have been difficult to actually get to a clinic appointment. We've gotten approval and in the process of hiring some new staff to help with the effort. We have approval for a community health worker that will be going out with our linkage and retention coordinators just to help with, emotional support, helping them to get personal identification, getting them linked to housing, helping with medication delivery. All of that I think will be useful. We've also gotten approval to hire a peer recovery specialist that would be ours solely. We do have a large peer recovery services department or addiction department at CMC, but we've not really had one that was person that was designated to us. So they'll be splitting their time within the clinic as well as out in the community to help with the community health workers and linkage workers that are out and about. And finally, we've also gotten approval for another early intervention specialist that eventually, we're still trying to look at doing HIV testing in the emergency department. So that would be 2 people so that we could cover most shifts at General Hospital every day of the week. Her name is Mackenzie Kemp, and she starts actually on Monday. So she will join Leslie Basset in that effort. And then finally, what is going on with the ED project? Well, we have had a small work group meeting. I know that Shannon and Amy and Melody have all been involved in that process. And we're still struggling with some issues related to flow and legal issues, and we're working through those. I think the next step is to try to get some outside expertise from other similar institutions that have had similar situations and have worked through that process, and hopefully they can give us some help with that. We've got the workforce and we've got the process. We just need a place and a process to get that incorporated into the ED flow. Unfortunately, because of COVID, our ER now, they're crazy busy. And so I've not really kind of pushed the issue on that right now, because literally people are lying on gurneys for 1 to 3 days in the emergency department because it's being clogged with COVID cases. So fingers crossed, by the fall, winter, spring, things will start to, cool off in relation to COVID, and we can get back into more focused HIV work. But that's my update, and that's kind of where we are. And hopefully next time I'll have some additional good news to report to you. But I think we are making some progress. It's not moving as fast as I'd like, but it's one step at a time, and I think we're starting to get there.
Thank you, Christine. Just really appreciate all the work that you guys have been doing over at the Ryan White Clinic, especially during this trying time that we're all facing. And I'm so excited to hear about some of the positions that you guys have been able to secure that I think is going to help tremendously. Next,
It's been a
we'll move.
process.
Yeah, isn't everything.
Yeah.
Next, I think Rhonda Francis is on the line for Health Right.
Let me unmute myself. I didn't
Oh,
want you to
there
hear
you are.
all the noise in the background going on here. Christine is a huge help, and we've worked together really well for years, first with pharmacy and now with this. Yeah, we're calling her all the time. And plus I give her cell phone out all the time. I hope she don't hate me for that.
No, actually, it's a great thing. It's nice to be able that we can, we're both seeing people sort of at different phases throughout all this. And we do, I mean, I think it's really important that we do.
Yeah, and we've actually saw a bunch increase recently, and it has worked out really well. So in 3 months time, we've tested 726 unduplicated patients on outreach. And we've gotten 74 patients on PrEP, which is good. That's an increase. But as you were talking about the 2 positives that we found and got them in with Ryan White, we actually got 2 started on Biktarvy that same day when I called Christine. So as long as they were willing, we actually had it there and had the samples and got them started and got their labs drawn immediately. Us getting the mobile unit has made a huge difference. And I see Melody's on this call as well. Melody works with us on Mondays. So that's made a huge difference for us to actually go out in the field, because as you know, it's really hard to get them to come back into the clinic and get labs drawn. So now we've started that process. And then, once you develop that relationship with them and they trust you, then they follow up for other things. One of the girls actually that we got on the Biktarvy has actually gotten in substance use disorder treatment as well. So she's getting treated for HIV and for substance use disorder. So it was a double whammy on that one. So we were really excited about that. And as we said, the COVID has just got us all in an uproar, and I hate the word because I thought we were kind of going down a little bit. In August, we COVID tested unduplicated over 4,300 people. So we're really strapped here. So we're in the process of hiring more contract nurses to help get out and do with their normal everyday activities that we have on the schedule. With that being said, we had a grant come through that we're actually going to be able to go out to 5 rural counties and test HIV and Hep C and COVID testing as we move forward. So that'll get us out there more. We're just all overwhelmed, I should say. With the lovely C word. So I'm hoping that we can get more people vaccinated, and we have seen that when we're out, we're adding that onto the mobile unit. So we'll have COVID vaccines on there. We got flu vaccine in today, and so that'll actually be on there as well out into our outreaches. So, a lot of positivity.
And hey, Rhonda, and today your birthday?
Yes, it is.
Happy birthday, Rhonda.
Thank you.
Yes, happy birthday. And I'm so happy to hear about some of the plans for this fall in terms of co-administering flu vaccines with COVID vaccines. We know how important that is as we enter respiratory season. Have you guys chosen the counties that you guys are looking at doing additional outreach to?
So we have chosen some, but it's because our mobile dental already goes there, which we'd have our mobile dental, which would be Logan, and we would have Roan. Those are definitely on there. Clay's definitely on there. We're looking at getting into Cabell and Putnam.
Awesome. Thanks so much for your update.
Thank you.
And then next we have Melody Wilkinson with DHHR for some updates on some of the ongoing activities, some that you guys have already spoken to, but Melody?
Thanks, Shannon. And I think that this is really a continuation of partner collaborations. So as we get started, just a thank you to all of the partners who are collaborating around these different initiatives. I want to talk about 3 key initiatives that have been prioritized. One is addressing the need for integrating testing in jails and working with Department of Corrections. One, additional Dr. Teague mentioned in integrating testing in the EDs, and then also education planning for stakeholders and providers. And as we were moving through each of these initiatives in collaborating with partners, in addition to looking at evidence-based practice and the evidence-based protocols, really giving a great deal of consideration to the operational issues and the best practices around programmatic implementation. And so in addition to the collaborations that have been mentioned here, has been working with subject matter experts across the country around some of the best practices when they have implemented similar projects. The goal with Department of Corrections, and we thank them for their collaboration, is working to integrate opt-out testing for HIV and Hep C during the medical intake of all individuals incarcerated in jails. We will make decisions as we move forward, can that, it might be implemented as pilots and then scaled, but the long-term goal would for it to eventually be integrated in across all of Department of Corrections. And as Shannon has discussed and Dr. Teague mentioned in looking at that continuum of care, when we are thinking about testing, we must include in that conversation linkages and then retention into care, because the ultimate outcome is ultimately suppressing the viral load of that individual, which impacts the quality of life for the individual, but that is what will decrease community spread. And so looking at that full continuum as a part of implementation of this project. Dr. T gave a great summary of the work happening with the emergency departments. We have had opportunities to collaborate with subject matter experts around the operational and implementation challenges and solutions that have worked for them. And we will continue to move that forward in meetings with our colleagues at CAMC, always recognizing that we can translate those best practices from operational issues and need to consider the contextual issues within our own community. But there's forward movement around those discussions. And again, anything that we reference around testing would also think about within that system linkages into care. And then the third initiative is developing curriculum for key stakeholders. And we're very appreciative of the collaboration with the AIDS Mid-Atlantic AETC, which is the AIDS Education Training Center program. And in addition to working with the AETC, Dr. Teague has participated in those planning meetings and sitting down to develop a curriculum that we feel will improve outcomes, not only with identification and testing, but engaging this population and then increasing provider knowledge, skills, and abilities around providing PrEP services across the community. We have worked to identify key learning objectives and outcomes in addition to the first set of prioritized or targeted population when the curriculum launches. We're finalizing a detailed work plan, and there will be more information coming shortly. And hopefully this group can help engage community partners and encourage them to participate in the education initiatives. We foresee that targeting everywhere from beginning from first responders across the continuum of care providers who are engaging this population. Thanks, Shannon.
Thanks so much, Melody. So we've heard today from several partners about some of the increased testing and outreach activities that have been ongoing. I know the Kanawha Valley HIV Testing and Outreach Group, which includes members from the Bureau, the Ryan White Clinic, Health Right, Covenant Health, and Manamil also are doing really fabulous work with over 300 people tested at over 26 mobile events. Melody and Christine have spoken about some of the recommendations that the EpiAid revealed in terms of improving opportunities for earlier HIV diagnoses through rapid expansion of routine and opt-out HIV screening in clinical and correctional settings using non-traditional outreach strategies. I'm going to open it up to the floor to see if there's other partners on the line who would like to share some of their ongoing activities on this forum. And don't everyone jump in and speak at once.
This is Joe Solomon with SOAR. I had some questions in the chat regarding the 4 deceased members of the community since 2019. I was wondering if those were connected to those folks' HIV or AIDS diagnoses.
Thank you for your question, Solomon. We are verifying that data right now. To our knowledge, none of those deaths were associated with their HIV diagnosis, but we are double checking the cause of death.
Thank you. Thank you. I also wanted to ask, I think it's been nearly 2 years since we've had these task force meetings. The first was in October 2019, I think, a few months before COVID, half a year or so. And I was curious now that the EPIAID has made it very clear that the #1 recommendation is to address the scarcity of sterile syringes in our city and county, if we'll be setting aside time to determine how the Kanawha Charleston Health Department can build a syringe service program along the lines of Cabell County, so we can actually address that gap in our community.
So I know from the state perspective, we are in the process of.
Okay, make sure you're muted.
We're in the process of putting together a response plan to address all of the recommendations. Obviously, some are going to have higher priorities than others, and we hope to discuss that further with the group next month. I know Kanawha Charleston is in the process of a transition period with Dr. Young still serving as interim. But we do definitely want to address all of the recommendations from the EPIAID within the context of our current laws and regulations.
Thank you, Shannon.
This is Joe Deegan from Thomas Health. I know that we continue to work with CMC, with Christine, about potential plans to start an SSP. You know, we're very early stage. We got to look at the state rules as they roll out to see whether or not that, just how we would go about setting something like that up. We know that we're going to have a lot of work to do in the community, you know, even in our direct neighborhood at St. Francis, to work with people, you know, folks in the community. We've already had a couple meetings, African-American churches, and some of the folks that have had some anxiety already, and you know, once we know what those rules are going to look like, I think then we are going to, you know, plan to reach out and see whether or not that is something that we can make viable at our site at St. Francis at some point in the future. I don't know if you want to make any comments about that, Christine, or.
Just that it's very, very early stage. And we're still discussing it. We still would like to see it come through, but you know, following what is now law, we have to be very cognizant of what those rules are, and those are still being tweaked, and we can't really move forward with a plan until we know exactly what that recommendation is going to be. But we're hopeful that we can make it work in some fashion.
Thanks for that update. Really hope that we can bring that to fruition. Is there other updates from anyone else on the call?
This is Cassie with Covenant House. I'll just give a quick update on what we're doing. We're
Thanks.
still working hand in hand, of course, with Health Right and Ryan White daily. Waiting for our testing to start back up and get back going pretty decently. But other than that, we're just trying to house people. We've gotten probably about 4 or 5 people housed in the last month. I got some apartments and houses available in Beckley. I'm trying to spread some people out. It makes recovery a whole lot easier if they leave the town they're in. And so we're trying some new methods of maybe hopefully getting them to, because I cover 22 counties, so they don't have to stay right here if they don't want to, and they still get all of our help in Ryan White's too. So just trying to spread some people out to get them recovery to be a little easier for them. Other than that, taking referrals from every agency we possibly can that diagnoses people, including ourselves. So that's about it.
Thank you so much, Cassie, for that update. Quiet group this afternoon. Anyone else with updates?
This is Dr. Jessica McCauley with Cabin Creek Health Systems. I was kind of waiting for some of my other more boots on the ground team members to comment if they wanted to, since I am involved but not there with them every day. Can you hear me okay? Oh, okay.
Yes, we can hear you.
We can hear you.
Okay. Thank you. Sorry. So we also recently have been able to fully utilize our mobile unit, including with testing for HIV, hepatitis C, hepatitis B, and also trying to get more COVID tests and vaccines out into these populations as well. And PrEP off of the mobile, so acute access PrEP as well. And just getting out into the reaches of the community as far as we possibly can.
Thanks so much for your update.
Would it be possible, since there's now, it seems like several groups that are doing similar things in terms of outreach and testing and PrEP introduction, if there was some sort of communication or schedule or mapping, just so that we could have sort of an idea of where people are, when they're going to be there, and maybe looking to fill gaps where maybe there's missed opportunity. Just a suggestion.
Yeah, I think that's an excellent idea. And I think that's a role that the Bureau could play, working with partners to put together a calendar of testing events. I know we do somewhat of an internal calendar, but we could expand upon that. I think that's a reasonable ask, and I think could benefit a lot of folks. Anyone else have any other comments on that?
There is the county, sort of the county testing collaborative that meets monthly, and there is a calendar, but it's primarily just has the scheduled Tuesday, Thursday events that the county is doing. I know that we in Health Right will put our stuff on there if we're doing some designated testing, but just the routine, Monday through Friday afternoon, where on the west side is Health Right? Monday through Friday, where's Cabin Creek going to be? I think a more comprehensive look at the mapping might be helpful. And is there anybody on this call from the county testing collaborative? Sean, Trista, I didn't see them.
Hi, it's Dr. Young. So I don't see them on here, but we do have the calendar to do the community outreach testing. We continue to make that a priority. In fact, we're trying to work towards doing exactly what you're doing with HealthRet and the other agencies, with offering COVID vaccinations, flu vaccinations, and all of that piece. But yes, we will continue the testing piece of it, and anything that we can do to try to enhance that moving forward. Christine, we can definitely talk offline as well.
Dr. Teague,
Yep.
I think that is a great recommendation, and I'd be interested in if folks see value in other areas in terms of making sure that we're looking across the system and across partner activities to do the same thing in terms of testing. Are there other areas where that would be helpful?
Okay.
Right.
All right. Well, thank you. That's okay.
And are there any other organizations that maybe aren't on this call that we're not aware of that are out there also doing some similar activity? I don't know. My guess is probably not, but
The only other mobile unit that I see out when we're out is the one from Parkersburg. It's like Saint somebody else.
yeah.
That's the only other mobile unit that I've ever seen. Other than that, it's just Cabin Creek, Health Right, and Rome.
Yeah, and the Parkersburg
Well,
people, that's mobile mat, is it not? Or do they do testing?
It's mobile
too?
mat and healthcare. So they were on Save a Life Day. We had a couple that was laying on the ground, and they came over and did some wound care on the guy and a couple other things. So I mean, they have mobile healthcare in there too.
This is Brooke. I've collaborated with them. I usually end up with them a couple of times a month at least, and they always call if they want a test done. If someone comes in and they know that they're high risk and they haven't been tested recently, the St. Joe's mobile unit's always really good about calling me, at least, to make sure that someone comes for testing.
And Brooke, do you know, are they here like once a month, twice a month? Do they have a designated schedule, and do they always go to the same spots?
It's the same spot, and it's every week. It's every Wednesday from 8 to 4, I believe, that they're there in the old Save-A-Lot parking lot.
Okay.
They don't have capacity for testing on their van, but they're happy to accommodate it if it's something that people want.
Gotcha.
So the peer recovery coach that's always out with that particular mobile unit, he and I we talk a couple of times a week at least.
Yeah, I knew that you knew them, and I couldn't remember how the testing piece how that was working.
We've been just kind of not on demand, but kind of, and then I'll usually stop by a couple of times on Wednesdays to check on them and see how it's going, and make sure to offer testing.
Okay, great, thank you.
The clients that they worked with the other day, they really liked them. So
they're really easy to work with, and it's a very low barrier way to access medication assisted treatment. So yeah, they've been great to work with.
Any other updates from the group? Well, I did want to take a moment, as we are going through this transition, to ask the group, obviously that it's really important for us to all get together in terms of sharing updates across the continuum and across all of our community partners. But is there something else that you would like to see in this group that we can discuss as a larger group, or maybe have some breakout discussions, or things that you would like to see presented, or specific topics we can bring up for the upcoming months? I just wanted to toss that out there to see what folks thought, what they find helpful, useful. moving forward, or if, you know, the regular updates is important and serves this meeting well.
This is Joe Solomon with SOAR. I'd be excited for us to troubleshoot ways for our health department to become a kind of tangible, hands-on leader when it comes to rebuilding harm reduction for our city and county. It's kind of open knowledge that we got into this pickle because we lost our health department harm reduction program 2 years ago, well, 3 years ago now. And we've had this task force for 2 years. So there's a lot of things we can do absolutely legally. We could give out bleach kits, you know, every day of the week with a tent in front of our health department. We could give out fentanyl test strips and even use federal funding so that we can lower the risk of fentanyl deaths, which prevent people from many things, including life. And there's probably other things that we could start to pilot, including leveraging the health department Facebook page to offer safe use tips and to talk more about the HIV crisis. So I'm wondering how we can spend more time figuring that kind of stuff out.
Appreciate those suggestions. Anyone else with others? All right, well, not hearing anything, we'll go ahead and sign off for the month. Really appreciate everyone hopping on during their lunch hour. You got 10 minutes until your 1 o'clock Zoom call. So with that, we'll go ahead and dismiss. If there is media on the event who would like to ask additional questions, we do have folks from communications who can help direct that. And thanks, everyone. Stay safe out there.
I think Katie Coyne had a question.
Okay.
Yeah, I think it'd be helpful if Shannon or Amy could answer. No offense to Andrea or Allison, they're incredibly helpful, but I think it would be useful. I'm not trying to say that this isn't happening. I fully believe that it is 100%. Could you maybe just give some like direct examples where COVID response is straining response to HIV too, whether that's among like epidemiologists, contact tracing, just specific examples that can help paint that picture for people trying to understand it?
Sure. I think that's a really great question. So in West Virginia, you know, we are a very small state, and when we have got a small state, we've got a small staff. So a lot of key players that are participating in COVID response are also, you know, essential individuals in the HIV response. You know, trying to juggle a lot of priorities. It is straining efforts in terms of planning efforts, response structure, in terms of like, you know, having a formalized response structure to actually respond to the HIV outbreak occurring in Kanawha County, because we have a formalized response structure already in place for COVID-19. And so just trying to juggle those priorities, especially in the midst of a very large surge, is very troubling, but it strains resources all the way from the top to the bottom in terms of key leadership positions to drive initiatives, to epidemiologists and, you know, DIS investigators being diverted to help with case and contact investigation during surges. It affects every facet of the response, unfortunately. And that's just, you know, that's public health, unfortunately. Often goes underfunded, and when crisis hits, it's all hands on deck, and we're all trying to juggle multiple responsibilities.
Thanks, I appreciate that. And just like some housekeeping stuff and stuff that we've talked about in recent weeks. At one point, there were talks of having a town hall in response to the EpiAid report. Obviously, COVID has complicated that too. Are there still plans for that? You know, do we have any discussions right now about how to present those findings to the public? Because that hasn't happened yet.
Again, excellent question. It has not left our priority list. I'll be completely honest with you. All of us are dealing with COVID response right now. And so in terms of prioritization, an in-person meeting is not ideal.
Right.
We are working on a formalized response plan that addresses all of the recommendations from the EpiAid. And one of the activities that we definitely want to see accomplished in the near future when we can do it safely is engaging community members to discuss some of the recommendations and how we can move forward as a community.
And this kind of goes off the last two questions, but is there a timeline for when we can get that formal response plan together? Obviously, COVID withholding and hopefully not getting any worse. But
Sure. So I hope one of the agenda items for next month is hopefully to review some of the response plan that we've been working on for the last couple of months. Obviously there's some short-term, midterm, and then long-term goals that we've got on that response plan. So hopefully we'll be able to speak more about that next month.
and I have one last one. I don't know if any other media on here has questions. I'm sorry for taking all the time.
You're fine.
We mentioned COVID or HIV in jails and stuff. Do we know how many cases there are actively in regional jails in West Virginia right now?
I do not have that information at my fingertips, but we can get that information from the program and respond through Andrea if you do need that information.
Okay. Thank you. And I thank you guys so much for saying this or for taking this time and answering the questions. I really appreciate it.
Happy to help.
Are there any other media members on here that had any questions?
All right, well, I have a 1 o'clock call with the Department of Education, so I'm going to sign off for this afternoon. Again, really appreciate everyone jumping on this afternoon and really appreciate the discussion we had this. Thanks.